But the third place that is really sort of not known to a large extent is fat. Okay, so the more fat you have, the more naturally secreting and circulating estrogen you have.
Dr. Higgins also deems obesity as an epidemic for the region, particularly here in the Bahamas. He explains how these two conditions interact.
They're independent, but they do interact. And so if you imagine a woman who is low energy, fatigued, what's she less likely to do? Probably less inclined to exercise. If she's less inclined to exercise, what is she more likely to get? Obviously increased weight, increased fat. If she increases in weight and fat, now you have that fat that obviously increases estrogen production, and that estrogen now increases the fibroids.
Now, when it comes to treatment, there are several options. The most widely known procedure is a hysterectomy.
It's usually an open surgery where they remove the uterus with or without the ovaries. The second option would be an open, so a full incision in the abdomen to remove the fibroids individually, where they're sort of literally scooping out individual fibroids.
Recently introduced to the region within the past 2 years is a procedure known as uterine artery embolization. Dr. Higgins explains that the doctor gains access to a blood vessel in the groin area to access an artery that supplies the fibroid.
The fibroids, like any tumor, it sort of grows its own blood network so that it can get its own oxygenated blood without having to compete. And so it takes that oxygenated blood and continues to grow and grow, essentially living high off the hog, essentially gaining that blood supply from the uterus. And so what we do in that situation is we identify that blood supply and then we block it off using little particles, some of which in certain situations we may not dissolve. Other situations they do dissolve, and what they do is they block off the blood supply just long enough for the fibroids to die.
He says 90% of patients return to normal menstrual cycles, and 2 out of 3 women see a 50% reduction in bulk systems following this procedure.